exotic beaches and natural wonders, Sri Lanka has long dreamt of a place among the world's top holiday destinations. But terrorist attacks in 2019 rocked the island nation. Then came the pandemic, shattering the tourism industry, while pushing many who depend on it into poverty. The collapse caused an economic emergency. Sri Lanka was running out of money. Now its borders are open again. Vaccinated tourists can return. Sri Lanka needs to revive tourism, but is that possible in a pandemic?
Hi, I'm Ben Fazul and good to have you with us. The long wait is over for Sri Lanka. Those tourism dollars are flowing again. No need for quarantine if you're fully vaccinated. And the government's giving frontline workers and those in the tourism industry booster shots against COVID.
They're among the first guests back at the surf camp in southern Sri Lanka. Alexander and Carolyn have come from Germany. They have waited for a long time to go surfing again. Their coach gives them some final instructions before they hit the waves. After 18 months of the pandemic, the surf camp set out a newsletter hoping to attract surfers back to Sri Lanka. And it worked. The hope is that they will attract other tourists back to the country as well. During the pandemic, we missed being able to travel. And so as soon as countries open up again, the surfers will be back. Nearby, those suffering from stress can come to relax. This Ayurveda hotel is very popular with German visitors. The tour operator emphasizes the freedom of movement in Sri Lanka. All you need is a negative test or proof of vaccination.
There is no need for quarantine any longer. Tourists can come to Sri Lanka and move around freely from day one. They can leave Ayurveda Resort. There's the 14-day Ayurveda treatment course, but otherwise they're completely free to visit national parks, for example.
The hotel is fully booked. The manager of this German agency specializing in Ayurveda breaks is happy. He hopes that tourists will continue to come to the island. Neil Washington has had some short nights lately, but he doesn't mind. His travel agency doesn't just welcome surfers. Many other international guests are returning, 12,000 since September.
Last night I had to go because there are a lot of tourists coming. I have to regroup the drivers to pick up them, arrange the transport, and welcome them from the airport. So I had to go to Colombo and I come back now.
The surf camp has been able to open again, but many other hotels and resorts haven't survived the pandemic.
It was very difficult because it was all down. It was down to the ashes because everything was closed and there were no tourism. So the tourist branch has affected very much.
And joining me now, two experts on tourism, Manoj Samaratunga in Colombo, and a more global perspective from Freya Higgins-Deviel in Australia. Thanks for joining us, both of you. Manoj, can we begin with you? Can you give us your assessment? Did Sri Lanka, or has Sri Lanka got it right in tackling this crisis, in supporting its tourism industry, how far it's gone, and in reopening?
Yeah, thank you very much, Ben, and thank you very much, Deutsche Welle, for inviting me to join with you today. And thank you very much for selecting Sri Lanka in particular to talk about how we are recovering from the two nightmares, the Easter Sunday attack and the COVID-19 pandemic. And now we are happy to say that with the guidelines of the World Health Organizations and the Ministry of Health, we have successfully combated the spread of the COVID-19 disease here in Sri Lanka. However, the risk is still there, and we have prepared our hotel staff and the airline staff and restaurant and to guide travel agencies on how to proceed with the new normal situations. And fortunate for us, now we have seen the green light and many tourists have started visiting Sri Lanka with their the vaccination cards, or if they find if they come with a negative certification of the PCR test, of course they can visit their pristine or preferred hotels without any obstacles from the authorities.
Okay, Manoj, so you say the risk is still there. Freya, can you chime in? Is it too risky to reopen right now for Sri Lanka?
Well, all the countries in the world are trying to find that right balance between public health and getting the economy back and running. A country like Sri Lanka will be at an advantage if it's one of the early openers, and I know that the Maldives is opened as well. So we all have to try to find the way to open properly and then invite tourists. And particularly there's an appetite for international travel because many of us have been locked down and having difficulties in travel. So, you know, there's a chance to take advantage of that really strong urge to travel, what some people are calling revenge travel, which is that really strong desire to get out there. So I think Sri Lanka is modeling the way and we can see how it plays out.
Manoj, what do you think about the risk of tourists bringing back COVID or a more deadly strain of COVID into your country?
It's an important question, Ben. Actually, we started bubble tourism many months back with the Ukrainian tourists, and we had our lessons right, and we learned them very much. And now that we have trained, as I mentioned earlier, we have trained our staff, we have certified the hotels according to the health and safety standards that they are maintaining. The tourists will also bring certain they might be contagious, but still they will go through the health and safety protocols. And because since we are following the strict health guidelines imposed by the World Health Organization and the Ministry of Health, and I think we will be able to overcome the challenges and the risks that come up with the tourists.
The other question I have for you is, do you really want all those tourists back? I know in some parts of the world it's a case of tourism not being sustainable for the environment or for the country itself.
Of course, Ben, and tourism being a very much sensitive industry to the environmental changes, cultural changes, and the economic changes. And we need the tourists badly because we all know that Sri Lanka is a developing country and we do not have that many foreign exchange in our pocket remaining right now. And the three main foreign exchange earners in Sri Lankan economy are the workers' remittance and the textiles and apparel, and the number three is tourism. And tourism in particular contributes to the 13% of the foreign exchange earnings, and that have dropped to zero level during the last year. And on the other hand, not to mention our foreign workers, about 1 out of 300,000, maybe 1/4 have returned home. And many of the micro and small scale and the medium scale garments have been shut down. So there's no way of earning extra foreign exchange, foreign currency back to Sri Lanka. So we have identified tourism is the easiest way to bring the dollars back to Sri Lanka, bring the euros back to Sri Lanka. And that is why we are strictly following the health advisors of the WHO and
Freya, expecting
to have more in the country.
Can I just ask Freya one question before we leave it? What about a more responsible tourism and more sustainable tourism industry, and one that also welcomes vaccine equity?
I think it's really important that we learn lessons from the COVID shutdown. So for a country like Sri Lanka and for visitors that are coming from Europe to countries like Sri Lanka, I think we need to look at how do we create forms of tourism that really spend money in the local economy and support local well-being. After COVID, we are going to find that the big multinationals are going to come out of this better than small to medium enterprises and micro enterprises. So I hope that countries like Sri Lanka think about getting a really sound mix and not being overly tourism dependent, and particularly on international visitors, and that tourists think about their choices when they travel. And this issue of vaccine equity is there, that we'd all be in a lot better position if we had looked as a global community to take care of developing countries, countries of the global south like Sri Lanka, so that we have equal access to the vaccines and better coverage. So as we go into the future, we've got COP26 happening and the threats of climate change. We are going to have future crises. I think we should look at the pandemic and ask ourselves, how have we formed a global community where we take care of each other? And that's how tourism thrives. Tourism thrives in countries that are safe, that are healthy, that have good well-being. That's how tourists are welcomed. And we'd all do better with that kind of situation.
Freya Higgins-Debiel and Manoj Samaratunga, thank you to both of you for joining us today on DW.
Thank you, Ben.
Thank you.
Another viewer question now from Derek Williams, and this one on susceptibility to the coronavirus.
Is everyone equally susceptible to COVID-19?
Well, obviously, people who are vaccinated or who have recovered from a previous infection with SARS-CoV-2, they'll be much less susceptible to infection or reinfection than someone who's unvaccinated or someone who has never been exposed. New evidence actually indicates that vaccines do an even better job of protecting you than a previous infection does, at least in the short to medium term, and at least against the current variants. Where things get interesting, though, is when you start looking at whether some people might be naturally immune to SARS-CoV-2 from the get-go because of their genes. Researchers have discovered genetic mutations in some people that make them resistant to other diseases like malaria or HIV. They just don't get them. Could there be a similar group of people out there who can't get COVID-19? An international team of researchers has now begun looking for those people. One promising source of data could, for instance, come from households where everyone got COVID-19 except for one person, despite extensive exposure. How come? Was it just coincidence, or did they maybe have a genetic mutation that protected them in some way? Hundreds of people who didn't contract the disease, even though common sense says that they should have, they've already volunteered for this study. Actually, identifying natural resistance, if it exists, will be very challenging. But experts say that the search is really worth it. First, because it would tell us much more about exactly how the virus infects us, and maybe why some people get it so much worse than others. And second, because the knowledge could provide really a huge foot up in developing new therapies, as it already has, for instance, with HIV.
Stay safe and see you again soon.